1 in every 100 Somali Norwegians have tested positive for COVID-19, while more than 1 in 5 of all coronavirus cases in the country were seen in people born outside Norway. The Norwegian Institute of Public Health has revealed in a briefing note submitted to the government. According to the note, 290 Norwegian residents of Somali origin have so far tested positive for the virus, a significant number in a community numbering only 28,696, and more than 10 times the prevalence within the country as a whole. Abdi Said, a politician of Somali origin with Norway's Social Left Party, last week told state broadcaster NRK that he felt the disproportionate number of Somali patients was sad. He added that it is a vulnerable group lived cooped up close together with one another, so there is reason to be worried. Somali Swedes, meanwhile, also made up a disproportionate number of those hospitalized with coronavirus in Stockholm, something health experts have said reflects how much more common it is for vulnerable elderly members of the community to share accommodation with younger ones. In Sweden, there has been a particular concern about the Swedish Somalis, where on the early stages of the pandemic in the country, at least 16 of 42 people to die from the COVID-19 in Stockholm were of Somali background, according to the Swedish Somali Medical Association. They believe lack of information among Somalis during the early stages of the pandemic may have played a role. Spain has reported 605 new deaths from coronavirus, the lowest daily tally since March 23rd, bringing the total death into the country to 15,843, while cases rose by 4,576 to a total of 157,000 infections. In the United States, the death toll has surpassed 16,600 with 1,783 new deaths in the last 24 hours, according to a tally by Johns Hopkins University. However, the number of newly hospitalized patients in the hardest hit state of New York has dropped to 1% increase. It suffered a glimmer of hope as the global death toll inches closer to 100,000 amid 1.6 million cases. More than 364,000 people have recovered from the disease worldwide.